Hello, this is Group 4. Today we'll be going over Scenario B. Our group members are Sophia, Sydney, Erin, Michelle, Megan, Meha, Tyler, and Veronica.
Hi, I'm Imogene. I turned 14 last month and I'm in grade 9 at Sherwood School in Ogden. Though I don't go there very often anymore, my parents are really busy with their work, so sometimes I stay at home to help take care of my little brothers and sisters. I know my mom really appreciates when I help babysit, and Dad gets off my mom's back when she's able to work more. While it's nice to be able to help out, I feel like I'm missing out a lot at school. My grades used to be alright, but they've really gone downhill. And I miss hanging out with my friends at school. My boyfriend Kyle comes to visit me while I'm babysitting though, which helps pass the time. Sometimes when he comes over to help babysit the kids, we fool around a bit when they're all down for their naps. We took it pretty slow for the first month or so, but then we both kind of just kept going one day. When Kyle and I first started fooling around, I asked him to wear a condom, but he got kind of offended. He said that it wasn't like he had an STI or anything, so there wasn't really a point in him using one. I didn't try to push it anymore because I was worried that I made him feel bad about himself or something. I haven't brought it up since then, so we still don't use one. I thought that I might been pregnant for about a month now, but I couldn't figure out what to do about it. I really don't want to tell my parents. My mom already has so much on her plate, and I know my dad would get super mad at me. I ended up skipping class today and took the bus here, but it took almost an hour. I really hope that I don't get home too late. I don't want my mom to ask where I was.
After the nurses at Sheldon Schumer met Imogene, they contacted our community health nursing team at the Acadia Community Health Center. They're concerned about Imogene's case and said that they have had other girls from Ogden come to their clinic before with similar stories. We realized that it was time for the nurses from our clinic to partner more closely with Ogden to improve the health of young people living in this community. To begin, we did a community assessment of Ogden and Sherwood School by completing a Windshield survey, reviewing census data, conducting a key informant interview, and holding 2 focus groups. From our Windshield survey and census data, we found that Ogden has a 9% higher rate of children living in low-income circumstances than the rest of Calgary. This indicates that there are financial constraints in this community which must be taken into consideration. The health services in this community are also quite limited. The doctors in Ogden are not taking on any new patients, so families looking for a doctor need to leave the community to visit a clinic. Overall, our 2 major concerns for Ogden are a lack of financial and health resources.
To begin our partnership with Sherwood School, we connected with the principal as our key informant.
Hi, thank you for meeting with me.
No worries at all. I have a little bit of time. I'm excited to hear that you had the opportunity to come here today.
Oh, thank you. I know you have a busy day.
Yeah, we'll have a couple minutes to talk, so let's get to it. Let's go to the office.
That sounds perfect. First question for you here. Where do people in this community go for health services?
Right, so within this community, we have 2 health services offices. I'm not sure what they are oriented around, whether it just be a drop-in clinic or certain health services programs for the community. I'm mainly unsure of their services because I don't use them. I don't know many people who do. They are generally fully booked and very difficult to find an opportunity to see a doctor. From what I can see and what I've heard, most people within this community must leave the community to access care.
That's really unfortunate to hear. The second question, moving on here, I know you don't have very much time. From your knowledge and experience in the community, what are some of the least effective and involving programs and services you have heard within the community?
Yeah, also within the younger age group of our community, safe sex practices and education seems to be limited. Over the time I've been here at this school, we have seen a steady population within the school and within the community of teen pregnancies. It also falls a little bit within our district as well. It's rather quite frustrating as a principal, a father, and a community member to see young individuals that need health services struggle to access prenatal care, sexual health clinics, or even screening access. I believe these issues are apparent throughout the community and not just for younger individuals. But as a principal, full-time, I witness the struggles of the younger generations more.
Thank you for those answers. Do you mind answering a couple specific questions about Imogene?
No, yeah, that sounds perfect. I can answer some questions about Imogene.
What would you say Imogene's relationship with Sherwood School is?
Oh, Imogene. I have a history with her. Many calls home, failed parent interviews, failing marks. She's missed a lot of school. And if she does come to school, her hair is usually unwashed. It seems like she doesn't really care about school. We just don't know how to connect with her. It wasn't until a while ago that we suspected something else might be going on at home for Imogene.
Could you elaborate a little more on Imogene's situation?
Yeah, I've called her house many times due to her absences. It's no wonder she isn't doing well in class. Often when I make the call to her parents, there's no answer, and it goes straight to voicemail. I've left numerous messages. and I never once received a call showing any concern. Well, actually, I haven't received a call back at all, ever. Also, I acknowledge that attendance issues are often a first sign that a student is experiencing life challenges, and school authorities have been working together to try and supply a solution for Imogene. I must admit, though, it's been hard to do, but it makes it that much harder when her parents won't get involved in the process. What can you do if the parents aren't willing to work with you? Although I did do a self-enrolled day workshop on neglect and abuse recently. It was a very thoughtful and well-done workshop. I learned so much, I admit, and I'm ashamed to be so blind and uneducated to this subject, but I think myself and other faculty at Sherwood School may have missed some signs of neglect from Imogene. I've recently started to file my observations, and I've been taking the whole situation much more seriously since that workshop. And I don't think our teachers and staff really know how to approach this issue. And I believe neglect and abuse education within our staff should be reassessed and prioritized. And I must add, Imogene isn't the only special case like this within our school.
Created using Powtoon.
The students listed limited time with their teachers as a major problem. They don't feel like that they receive enough support from the teachers and administration of Sherwood. We also asked the students if they had any insight into why attendance was so low at their school. They said many families had financial difficulties, their parents often need extra help at home, so students skip classes to take care of their younger siblings or help with chores. Teachers working at Sherwood often state feeling burnt out and overworked. The school also doesn't receive adequate resources and funding to support student learning. When teachers try to bring new programs into the school, they rarely get the supplies and support they need. Also, the teachers are hesitant to ask sensitive questions to their students as it may potentially ruin good rapport. To finish our assessment phase, we created a SWOT analysis to summarize our findings. First, the strengths of Sherwood School are that the administration and teachers are supportive of their students and want to improve what the school can offer. Additionally, Ogden does have some community services that aim to improve social bonds within the community. Next, the weaknesses of the school are that the students have poor coping skills and health literacy. There's also limited access to health services in the community. There are many possible learning opportunities at Sherwood School. Both students and staff are interested and willing to learn more about health promotion for this population. There are also opportunities to build stronger social support networks in this community. Additionally, existing resources in Calgary can meet some of the needs at Sherwood School. Lastly, Ogden is a lower income neighborhood, so it may be challenging to implement sustainable programs. We are also unsure of how supportive the greater community will be to our programs, especially families and students. With the data and information from our assessment, we formed an actual diagnosis addressing the lack of education on safe sex practices and healthy communication for Imogene. Further, our potential diagnosis addresses unhealthy coping habits within Sherwood School. Lastly, our risk diagnosis addresses the risk for prolonged exposure to child maltreatment.
For our first intervention, we decided to have a one-on-one session with Imogene at our sexual health clinic. We're focused on Imogene to develop personal skills by educating her about safe sex practices, healthy communication, and giving her resources for domestic violence. So how does our first intervention fit within the population health promotion model? The action level is individual with Imogene. The CETOs are education, personal health practices, and coping skills. For our action strategy, we are looking at developing personal skills, and our foundation is evidence-based research.
From our appointment with Imogene, we hope that she realizes the importance of using contraceptives and uses them routinely. We also want her to learn and adopt healthy communication skills that she will use with her boyfriend. Furthermore, we followed routine screening protocols for abuse and neglect and decided to follow up with Imogene and provide resources for her and her mother. A long-term goal for Imogene is for her and her mother to move out of their domestic violence situation into a safe and compassionate space. During our initial assessment, we did routine screening to check whether Imogene could potentially be facing domestic violence. She confirmed that her dad is abusive to her mom, so we wanted to intervene by partnering with the Equally Safe team. Through intersectoral collaboration with Calgary Police Services, counselors, and case managers, we can connect Imogene with organizations in her community that can help her and her family. We will provide Imogene with resources on shelters and support networks to better help Imogene and her family.
The first aspect of Intervention 1 includes educating Imogene about safe sex practices. So here we are teaching Imogene about different types of birth control and the importance of using them. We're also going to help her decide which method will be best for her and explain how to use that method. So during the appointment, Imogene decides that condoms are the easiest option for her, and from there, we educated her about how to use one properly.
We also provided Imogene with free condoms from our clinic so that she doesn't need to worry about buying any.
Many youngsters fear that a request to use a condom may be misinterpreted as a lack of trust in their partner. In this intervention, we would like to educate Imogene on healthy communication with a partner, like building assertive skills, which can help her negotiate safe sex practice. Second, build trust, which is a core variable for healthy communication. Without trust, your partner might not be open to discuss safe sex talk. Third is problem solving. Having a discussing approach is where both parties view their disagreement as an opportunity to share their thoughts and gain better understanding, which leads to finding a solution. Our evaluation determined that Imogene has increased knowledge of the importance of safe sex practices and has learned healthy communication skills. Imogene utilized the resources that we provided. The Equally Safe team helped her and her family move into a safe, stable, and supportive environment where Imogene has the opportunity to attend school consistently. In doing so, Imogene and her family have better control over their life.
For our second intervention, we chose to partner with the Alex to implement a mobile health clinic within the community of Sherwood School. Our goal is to enhance coping skills through creating supportive environments that encourage togetherness and relationships. Within the population health promotion model, our intervention focuses on community level of action to address several determinants of health services, healthy child development, and health practices in coping. Our action strategies focus on reorienting health services and creating supportive environments. As evidenced by the Windshield survey and SWOT analysis, the community has limited access to mental wellness services. We collaborated with the school administration to implement this intervention. We noted that limited knowledge and access to services had a negative impact on the community, as evidenced by the assessment. Through the Alex's Youth Mobile Health Clinic, we hope to expand knowledge and increase access to physical, mental, and sexual education and health services. By having a place to gather where Imogene and her peers can feel safe and openly express themselves, we hope to empower them with knowledge while focusing on preventative initiatives.
A mobile health clinic is usually a van or a bus that provides health services, including physical exams, disease and infection screening, mental health services and supports, connecting individuals with other community resources, and health education. The flexible nature of a mobile health clinic allows health services to be delivered to communities that are typically underserved by traditional healthcare establishments. People don't have to go far to access healthcare, which is crucial for implementing preventative interventions. A lot of the evidence surrounding mobile health clinics has come from the United States, where they have experienced great success because of this patient-centered approach. Mobile health clinic patrons reported that they could build rapport and trusting relationships with the staff at the clinics, and thus were more inclined to visit the mobile health clinics for their physical and mental well-being. We propose expanding existing services by adding a second youth health bus. Currently, the youth health bus visits 8 schools around Calgary bi-weekly. By adding a second bus, the reach of this program would expand to Imogene's school. Additionally, we propose scheduling school visits weekly so that there is greater continuity of care and students are able to access health care services in a more timely manner. Our goal is to empower individuals by teaching coping skills and facilitating connections within the community. We want to extend the hours both before and after school so the bus can provide a safe space if an individual feels unsafe in their home, while also increasing opportunities to build rapport between students and healthcare professionals. The healthcare team will also be able to provide useful community resources to students. Ultimately, we want this bus to feel like a safe place for students to go where they can develop social support networks with healthcare professionals and receive medical and social supports. The bus will have food on board so students like Imogene can access free food if their families are experiencing food insecurity. Even if students just want to chat and eat a snack, the youth health bus can serve as that safe and supportive environment. For our process evaluation, we acquired a second youth health bus to expand the Alex's current program, thus increasing accessibility for students. We conducted surveys directed at the student body and evaluated that students felt an increased sense of empowerment and knowledge of available resources. Students also reported that they felt more confident in their coping skills and used these skills following graduation. Lastly, through sexual education and healthier sex practices, we evaluated a reduction in reported unplanned pregnancies within the school community.
Our third intervention is to support educators in screening for child abuse and neglect. This secondary intervention will ensure all teachers have knowledge of child maltreatment and an understanding of how to respond through standardized mandatory training.
This intervention creates supportive environments and builds social support networks by improving teachers' knowledge on the effects of trauma and how to support trauma-impacted students. This strategy builds healthy public policy by mandating training for Alberta teachers and supports Canada's mandatory child abuse and neglect reporting laws. At the sectoral level, this policy will clarify ambiguity around duty to report and reduce reporting hesitancy. We aim to improve school social environments by increasing educators' capacity to emotionally support students.
Teachers are likely to encounter victims of abuse, since 27% of Canadians experienced abuse before age 15. School professionals report 24% of all child maltreatment cases in Canada, highlighting the potential for educator intervention to protect Canadian youth. Family violence is difficult to detect, and a large component of addressing it is being able to recognize the signs. While there are resources available to support teacher knowledge on child maltreatment, there is no standardized, mandatory training for teachers, and Canadian educators have expressed a lack of confidence in being able to recognize child maltreatment.
To ensure the intervention was accurate and far-reaching, we collaborated with organizations that specialize in addressing child maltreatment. The intervention will be highly accessible through online resources and funded as part of the teacher professional development. To optimize knowledge retention, training is renewed every year as revisited learning reinforces attitudinal changes compared to a single session of learning. For short-term and intermediate goals, we aim to have all current members of the Alberta Teachers Association complete the training within 1 year of the program being released. We aim to see an increase in knowledge of child maltreatment and better personal skills among teachers. For long-term outcomes, we hope to see an increase in reporting by educators due to the increased knowledge from the training. Furthermore, we hope to notice a stronger connection between students and teachers.
Our vision is to see the Alberta Teachers Association adopt child maltreatment prevention training as a requirement for membership, since membership is an employment condition for all Alberta school teachers. Precedent for this program has been set by the Ontario College of Teachers, who implemented mandatory sexual abuse prevention training in January 2022. Our training will include how to recognize and respond to child maltreatment, which includes reporting the effects of trauma, trauma-sensitive practices, and wellness management for teachers.
Our evaluation of this intervention consisted of pre-test and post-test surveys. The results showed a significant increase in teachers' knowledge and skills for reporting child maltreatment when compared to the pre-test surveys. We found all members of the Alberta Teachers Association completed the training within the first year from the release date of the program. Surveys showed increased comfort in reporting and recognizing signs of maltreatment. Through the impact evaluation, we saw a rise in reports of child neglect and abuse due to the increased confidence to address and report maltreatment. Because of the success of our intervention, other teachers' associations throughout Canada started implementing the mandatory training as well.